So the anterior total hip replacement is a modern hip replacement. So most hip replacements are done either through the lateral approach, which is the side approach, or the posterior approach, which is through the back. And what's developed over the last few years is a minimally invasive technique where you split muscle instead of cut it, and you go through the front. The beauty about the anterior total hip replacement is that they do have a lot less pain. And the nice thing about that is they can get up, they can move quickly. They have very little restrictions, unlike standard hip replacements that usually have significant restrictions in terms of mobility, activities, and how they maneuver their leg. So they can get up, they can get walking on it right away. So what we've been doing at Southlake is outpatient direct anterior total hip replacement, which is quite a remarkable feat, considering only 5 years ago people used to stay 4 or 5 days in hospital.
I'd feel sharp pains, and then after running or after any kind of exercise, I had developed this hitch where I was walking with a bit of a limp. And looking for another referral, I was introduced to Dr. Gamble, who had a refreshing approach, modern age thinking with a new surgery. I'm back running, back golfing. I'm doing everything that I want to do. I'm bicycling, I'm rowing, I'm doing my squats. My weights are a little lighter than I normally carry right now, but I am starting to introduce a little bit more weight as I go along. And it's only 6 months after the surgery and I'm able to do all of that.
It is quite a testament to Southlake as a hospital and to our Department of Surgery in that we're a community hospital delivering regional services at a tertiary level and quality. And now to be able to do that on an outpatient basis and to do that in a way that allows people to return to function and to the activities they like doing in a quicker way, it's awesome.